Hello, everyone. My name is Natasorn Chongcharoenmonkong. My student ID is 67170008. And today I'll be presenting the modern management subject. So let's start. The topic is about deconstructing contextualizing and assessing management and leadership in dentistry by Sally Jane Hanks, presented by me. Let's further look deep in the background. So leadership is a dental training, improve patient safety, quality of care, and organizational culture. Um, in leadership, we're just completing the patient care to make the treatment become successful. Authentic leadership development needs clear, meaningful constructs and well understood outcomes. So when you're operating something or when you're operating a patient in dental career, you need to know what is the outcome, what is the expectation, the thing that will make you success. Existing literature lacks empirical studies on leadership at the clinical practice level. This study addresses that gap. So it's as business and dental aspects sometimes doesn't go together. So this is the background. Let's move on to the methodology of that uses in this research. Blended research designs combining case studies, direct observation, and video reflective ethnography. So they conducted many types of the research and they combine it together in a summary. Used activity theory to emphasize complex interactions and co-construct knowledge in context. Bottom-up context, sensitive approach, identify core activities in dental practice influencing leadership. Now let's move on to core activity systems. Patient care, clinical work and interaction with patients, running the surgery. The surgery, managing day-to-day operation within the dental surgery, running the practice, overseeing business and administrative aspects. So let's go with patient care. Patient care, let's dip it in. We need to, as a dentist, we need to have the interaction with patients. Ask the patients, what are their problems? What are they seeking? Why are they seeking these dental operations in your clinic? And running the surgery, it's really crucial of you to manage each time, manage your surgery in day-to-day basics. Running the practice. As you work, you are practicing yourself, your ability. As you work, you can improve your business, improve your skills in dental field. And these three interconnected activity systems provide insight to how leadership is enacted. Key leadership concepts identified. Organizational level, leadership related to ensures and goals. So we need to understand the goals, the expectation, the outcomes of what are you doing. Community of practice, influence of professional community and team culture. So as a business, you need to have a key identity, like a key culture. Like in this, we have an interaction, our culture in the environment you're trying to make. Personal position, the dentist roles, clinician, business owner, and team member. As we open the business, we're not only a dentist, we are entrepreneurs. We're a businessman, businesswoman. So we don't have just one job. We have multiple of jobs. And to do it, you need to have a good personal position. Know your position. Know who you are and what is your job. Identify identity formation, development of personal identity and personal values. So you need to understand yourself. Know your values. You have values. Know your power. You got power and you know how to use it well. and the ability to use will make you successful. Relationship, quality of interpersonal relationship, dentist and nurse collaboration. So when you're doing a surgery, you're not doing it alone. You also have a nurse or someone to help you. So this is a really crucial if you have understanding, communication, know what step you're on and what is the next step you're gonna do. That is why this will be really good to make the operation the outcome will be smooth. Capability and flexibility, adapt to learn and handle various situations. As a dentist, there's a many types of teeth, many types of patient, many types of operation, and many types of tools to learn. Operating machines and the ability of this to adapt to change will make you a really good dentist to handle every situation, whether it's a bad or whether it's a new or something that you haven't experienced before. If you are adapt and will learn enough. Prerequisites for effective relationship. High emotional intelligence EQ to navigate interpersonal dynamics and patient interaction. EQ, understand the environment, understand other people thinking, know what the patients are going through, understand them, try to try to have empathy, try to have sympathy. Strong professional identity formation with self-reflection and leadership development. So if you want to be professional in this field, you need to have an identity. Know yourself, I told you. Know who you are. If you know it, you know what is your goal are. This is a really good term for leadership development. Effective stress management skills to maintain performance under pressure. As a dentist, you perform in really different situation and which is really stressful. So you should know how to cope with your stress. When you stress, what should you do? So people have many kind of stress management. Solid collaborative relationship between dentists and dental nurses for effective work. As I mentioned before, understanding your teammates. Know communication, compromise, talk with each other so we could understand the relationship between you and the people who you work with. Let's move on to the challenges and contextual factors. Differences between practice owners, principals, and associate dentists create verifying leadership dynamics. So imagine if the owner of the clinic is not a dentist. So there's a businessman who is the owners, and there is a dentist who work for them. First, they need to understand each other, know what is the work, know their jobs, know what are they managing. Cooperate. Dental organization, dental body cooperates, introduce unique challenges to autonomy and leadership. Yes, you need to cooperate. I have a teamwork with your team, and a successful teamwork is having a good leadership. The one who leads, the one who decides, the one who creates the environment. Dentists face internal role conflicts. Clinician versus manager versus individual practitioner, impacting leadership approaches. Well, it doesn't then, well, the problem is not about dentist and the patient. It's a dentist and their teammates who they work with. As I meant, yes, who they work with good communication, with good leading, and how you manage your team and yourself. This is a really good term and key factors. And lastly, the conclusion and implication. Develop conceptual framework aligned with modern leadership theories while preserving real-world complexity. Framework applies across all dental practice level, informing leadership, development, and training. Provides a new evidence base for assuring leadership in dentistry, bridging the gap between theory and practice. In conclusion, you need to If you are a dentist and open a clinic, you become a business man or businesswoman. These terms and these factors I mentioned before, understand yourself, understand others, know your goal, know your power, know the thing, know your ability. This is a really good key terms, bridging the gap between theory and practice and make it possible, make it successful, and make it happen. Me, I am Natasorn Chongcharoenmonkong, and I'd like to thank you for listening to my slides presentation, and I hope you enjoy your day. Bye-bye.